We try and meet the community needs. So they don't want big flash, programs, but they want programs that are going to work. I don't understand why I can't keep the young well all through their life span, as opposed to, I've got to wait till for them to be diagnosed. There's so many restrictions and restraints within the resource that we're given. And it's a very small resource as well. Our policies are derived from Canberra. And that creates issues with the way that I manage, because sometimes I don't see that, an issue in the Northern Territory, in a remote community, may not be one of my issues locally and in an urban setting. I came in originally as the Chief of Staff, and I acted as a change manager because the board were wanting to review their programs and bring it all through to the 21st century, which was their mandate, and which I've taken that solely as my brief. We've endured quite a number of challenges along the way. As any organisation undergoes change, it's quite an upheaval. I only asked that once I started the change management, that we didn't stop. We had to keep going. And that they have done. Really the board's belief, because they're the ones that are, they're the experts of what's needed in the community. And I think that's one of the things that, we overlook as an asset and as an advantage to community control. I'm just the catalyst in all this, and what their beliefs are and values, I try and embed that in our new way forward. Prevention is going to be a big component, and I want people to lose weight, to become more active. If we can just contain those two elements, we're least likely then to move on and get a chronic disease. We're seeing about 1,500 occasions of service across the organisation, and that would be conservatively stated. We're also seeing a high percentage of new registrations as well. You'll find that sometimes people will trick to Redfern merely to see our doctors, and they know that we're going to look after them. That dedication. I'm looking for people that are dedicated, dedicated to the movement, dedicated to Aboriginal people. All the main diseases that we're more likely to suffer from, we've got the specialists to come on campus. And that makes it easier as well. And people are more likely to turn up for their appointments, and they're trusting us that these people are going to provide them with the best care possible. And I think that's part and parcel of an AMS. We run a surfing program in the summertime. We have 20 kids and they turn up 8 o'clock in the morning. And because we give them breakfast because they were starving before lunch. And I said, I know it takes it out of you. So their parents just love seeing the photos and to see the kids being able to stand up on a surfboard. They achieved something and they loved it, just their little faces. And, we don't write anything about that, or we don't tell anyone about those achievements, because no one wants to know about it because no one funds it. Because, we've got Aboriginal people managing the needs of the Aboriginal people. So, and that makes the difference.